In national stories, another medical crisis is taking place. Around 73 children have died in Bihar's Muzaffarpur district this month. The deaths are being blamed on a phenomenon called acute encephalitis syndrome, or the AES. Reports suggest that 73 children have died in Muzaffarpur and another 10 children have died in the Vaishali district of Bihar. The diseased children are mostly in the age group of 1 to 7 years. Meanwhile, the Sri Krishna Medical College and Hospital is being blamed for medical negligence, as there seems to be no stretchers, wheelchairs or ambulances for the patients. After living in a bubble for the first 12 days, Bihar's health minister finally admitted that the children had died due to AES. The World Health Organization defines AES as an acute onset of fever and change in mental status or new onset of seizures among a person of any age at any time of the year. It can be caused by bacteria, fungi and even viruses of various different strains. The symptoms include sudden high fever, convulsions, severe vomiting, weakness and unconsciousness, mental confusion, disorientation, delirium or coma. So is this disease new to India? Not exactly, because the AES is an annual phenomenon. It usually happens at temperatures above 42 degrees Celsius. Children below 15 years are the worst affected. The worst hit regions in India include eastern Uttar Pradesh and western Bihar. In fact, this disease has been a challenge for the health department since it was reported 25 years ago. In 2010, 120 children were reported dead because of AES. In 2014, 90 such deaths were reported. The Bihar government, along with UNICEF, had adopted standard operating procedures. These involved government officials visiting households, checking children for low blood sugar and high fever. But this year, the standard procedures were reportedly not followed. Health authorities reject such reports. Acute encephalitis syndrome claimed many lives in 2017 too. 1,300 deaths were reported in UP's Gorakhpur alone, most of them linked to acute encephalitis. Since 2010, more than 75,500 cases have been reported in India. A bulk of them were from Uttar Pradesh. The state government introduced a vaccination program in 2018, and reports say it has substantially reduced the number of cases. Let's also take a quick look at what else is making news in India. Prime Minister Narendra Modi is back in India and he is hitting the ground running. Modi will chair a meeting of the Niti Aayog Governing Council, the first meeting after his return to power. Reports suggest that the issues at the top of the agenda are drought combating measures, farmers' distress and rainwater harvesting. The meeting will be held in Rashtrapati Bhavan and will be attended by chief ministers, lieutenant governors of union territories as well as many union ministers. The protesting junior doctors at the NRS Medical College will be meeting today to decide on Mamata Banerjee's invite to hold talks. West Bengal Governor K.N. Tripathi had called the Chief Minister to discuss the issue, and the Chief Minister is likely to pay a visit to Raj Bhavan later today. So far, 800 doctors have submitted their resignation as a mark of protest. Meanwhile, the Resident Doctors Association of AIIMS have issued a 48-hour deadline for the implementation of their demands, failing which an indefinite strike will be organized at AIIMS. 5 security officials have been killed in a Naxal attack in Saraikela in Jharkhand. The 3 jawans and 2 police officers were ambushed while patrolling a local market. 3 incest rifles and 2 pistols were taken off the officers after the attack. Jharkhand's Chief Minister Raghubhar Das has condemned the incident and sought a detailed report on the matter. A top official from the Ministry of Earth Sciences has said that cyclone WION might recurve and hit the coast of Kutch. Earlier, the cyclone had skirted the Saurashtra coast and moved into a northwestern direction, much to the joy of local residents. If the recent update holds true, the cyclone is likely to strike the coast around June 17th or 18th. The other possibility is that the cyclone might weaken and dissipate over the Arabian Sea. A fire has broken out at a pesticide factory in Meerut in the Mokampur area. 9 fire tenders have been rushed to the spot to bring the fire under control. The cause of the fire is currently under investigation. Luckily, no casualties or injuries have been reported.